And good evening. We begin tonight with a call for help that leads to a domestic dispute suspect being shot by Milwaukee police. Now, this happened near 9th and Hampton. Marquita de Kaiser called police while fighting with her husband, Alan, inside their home. She told officers Alan took out a gun and threatened to kill himself. When police arrived, they shot Alan, injuring him. Marquita says this was not the outcome she hoped for.
I called for help. I wanted help, not this at all. I was trying to get help for his mental.
Police say Alan was taken to the hospital. No officers were hurt, and the officer who shot Alan is on administrative duty. Now, as you just heard, the wife says she called police with the intent of getting mental health help for her husband. Ben Jordan goes in depth tonight on how officers are trained to respond to mental health calls in Milwaukee.
The Milwaukee Police Department has a program in which mental health professionals partner with officers on scene. They were called on more than 900 times in 2021. But there are situations where social workers can't always assist. The Milwaukee Police Department responded to nearly 8,000 mental health related calls last year alone.
We're tasked with a lot of different roles, one of them being mental health, but we can't be an expert in all fields.
That's why in 2013, MPD launched what's called CART, Crisis Assessment Response Teams, where 3 specially trained officers are paired with social workers to diffuse mental health crises in real time.
They can't go into a place where it's unsafe. The scene has to be secured, and for the social worker's safety, and then they can go into to make that dialogue with the consumer.
Lauren Hubbard manages the CART teams in Milwaukee. She says their social workers have extensive training to determine the best way to help those in need.
To have a mental health professional who is trained in crisis response and crisis intervention to be a part of that response is truly helpful to be able to help people choose the resources that they find are most helpful for them.
The Milwaukee Police Department says in 85% of the CART team's responses last year, the situation ended without the subject needing to be detained. Lauren says Milwaukee has approved funding to expand from 3 CART teams to 6 so they can provide the service around the clock. Right now, CART teams cover 13-hour shifts on weekdays and 8-hour shifts on weekends.
Do you believe this approach saves lives?
I do. I do think that this approach saves lives. We have the opportunity to come into the community where folks are needing help and assistance in a trauma-informed way, person-centered, reaching people where they are and being able to offer voluntary options.
What we do in the United States and in Wisconsin is we allow a mental health crisis to get to a crisis instead of treating it earlier.
Mary Kay Battaglia is the executive director of the National Alliance on Mental Illness in Wisconsin. She believes more resources are needed to address mental health before a problem becomes a crisis.
What we would want is people to take behavioral changes prior to having a heart attack. So if we just allow mental illness to get to a crisis, yeah, we're going to need more CART services. What it would be so much better is if we had more mental health providers in the state, if we had a better mental health system, if insurance identified and acknowledged that mental health is as important as physical health, if we treated it downstream, then we wouldn't need so much of a crisis response.
Milwaukee County has a crisis line, which is on the bottom of your screen, to directly link residents who are dealing with mental health crises with resources. Reporting outside of MPD headquarters, Ben Jordan, TMJ4 News.